Welcome back to San Antonio Living. This morning we're taking the chance to tell you about a new recovery center here in the San Antonio area. We've got the chance on this show to reach out and help people and get information out there, and we want to take the time to do that and introduce you to this great facility this morning. It's called SOBA Recovery. Greg Hannley is here. He's the CEO of SOBA, along with Alex Dragici. He is the Director of Operations. It's so good to see you guys this morning. I'm very excited about this because, you know, in our lives, we all run into someone who's struggling with addiction, whether it's yourself, whether it's a close family member or a friend. And it's nice to know that there's a place here in San Antonio where we can get more information about some of the things that they're dealing with. So let's talk about SOBA real quick. How long you guys have been here, and just tell me about the facility.
Well, we've been working on getting our license in San Antonio for about 8 months now.
Okay.
And I have several facilities in Southern California. And we have a little different approach to the traditional idea of what going into a recovery center looks like. So it's multifaceted. There is a medical part. When people first come in, they got to go through a detox process to get feeling better. They're usually in pretty bad shape. We have the top doctors that take a look at what's going on and make a protocol to get them through that safely. Then they will go into a therapeutic kind of review where they'll be introduced to their therapist and their case manager. They'll meet a addiction specialist who will do an evaluation on what's been going on, not just currently, but what has been going on throughout their life, what their family history is like, and put a profile together that will help them create a treatment program to that individual.
And I want to stop you right there because that's something that we need to talk about. You've got to investigate what's going on in each individual's life because usually there's an underlying reason that they're dealing with addiction. And Alex, let's talk about that a little bit because you know, everybody's got something that they're struggling with, and you've got to find out what makes them tick, what makes them turn to drugs or alcohol, and you've got to fix that.
Yeah, it's specific to each individual when they come in. There are a lot of common ones. For example, anxiety or depression are two of the main underlying issues that happen with the drug and alcohol addiction. So when they come in and they're getting their, you know, biopsychosocial and a psych evaluation done, the medical staff makes the program specific to each individual.
Okay, I want to talk about the staff as well because you guys offer a lot of different services at SOBA, and you have got well-certified staff in place to deal with whatever it is that's ailing us, basically.
They're the best that we could find, and I really have been blessed in San Antonio with the people that have come out that not only have the experience, but they have the heart and the passion for what we do. And the team that has come together has really been a gift. They're all, and each one is specific to certain aspects that are going to be necessary for recovery. So the doctor, I couldn't find better. Dr. Butts is our medical director, and he is awesome. I love him. And Courtney Cody has recently joined our staff, and she's a rock star in this. And people knowing that those two are associated with this, the best quality people, have come with my criteria is, if my kid or somebody I love had a problem, I want to make sure that where my facility is where I would recommend them.
Absolutely.
And these people are the best. And we've had the holistic piece coming together. I've let the staff here in San Antonio, I asked them, if you could design what the best is that you would in your mind, go ahead and do that. And it's really become that.
I know you guys work with a lot of alumni who have gone through a situation like this, and you take information and feedback from them and try to put together the best program.
We do, and we're taking advice from people who have been in San Antonio doing this for a while. We had a really nice welcome yesterday. We got to tour a facility, Alpha Home, here in San Antonio. We had a personal invite from Julie Wisdom Wild there. And just everybody in this city has been really, really welcoming for
Well, that's so good to hear.
And supportive of what we're doing.
You know, there are a lot of people that need help in this city, around the country, and we're glad that you're here for them. We're going to take a quick break. When we come back, we're going to talk a little bit more about some of the different services you offer at SOBA, and we're going to talk about how to talk to someone who you think might have a problem. We've got all of that coming up more on San Antonio Living. We'll be right back. Welcome back to San Antonio Living. This morning, we're getting the word out about a new recovery and treatment center in the San Antonio area. It's called SOBA. You can see the website there, SOBATexas.com. The phone number, if you or someone you know needs help. A beautiful hill country setting. This is something that got started out in California, and now they've brought it to San Antonio, Texas, to treat people in this area dealing with addiction. CEO Greg Hannley is here, along with Director of Operations Alex Dragici. We've been chatting a little bit about the facility. It's absolutely beautiful. And for folks going through recovery, I know the atmosphere is very important to them. Did you take that into consideration when you chose the hill country?
Absolutely.
Yeah.
We don't want to have a punishing or a hospital environment.
Right.
And kind of in Texas, out in Malibu, it's more of a beach kind of vibe. In Texas, we got a ranch.
Yeah.
And we have a lot of animals, horses, chickens, goats. We have and we'll do like equine therapy and some animal therapy. One of our neighbors has imagination, and they've offered to come over and work with some clients. So it's designed to have people not be in a hurry or feeling they're stuck somewhere and they got to get out of it. That we want to give a good, mellow, relaxing, comforting atmosphere to people.
Does recovery take 30 days, or does it take longer than that?
No, 30 days doesn't work. Yeah, that is a myth, and it's kind of a dirty secret. A 30-day treatment is designed to fail because knowing that people will come back and you could get paid again.
Right.
And I found that out a while ago, and it was quite shocking to me. Statistically, the longer somebody is in, you don't get sick in 30 days.
Right.
And so by the time somebody detoxes and they start their treatment, they're just starting to form a trust with the people that they're dealing with. And so now having somebody in an inpatient environment for extended length of time, that makes them crazy too. So we have a step-down program where they start at the main facility, they detox, get to know their therapist, and then they step down to some beautiful apartments, and then they come to a day program, and they can stay for up to a year.
And that's what we're seeing right here, some of the interior of the facility. I know it's been a long time in the making, but you guys do something a little bit different than some of the other recovery treatment centers out there. You like to approach recovery holistically. And what does that mean? Because I'm thinking if I put someone in treatment, I'm treating them with medication, with more other things that they could get addicted to. You're trying not to do that.
Well, yeah, you don't want somebody to come in on one thing and leave out on another. And there is facilities that do that because it's easier to deal with people when you're giving them a bunch of drugs. We do the hard work, and the goal is to get somebody clean and get a baseline for where they're at, figure out, and like Alex said, a lot of the underlying issues are anxiety and depression, and that's easy to figure that out.
Right.
But you got to figure out what has caused that. So somebody who might have some trauma in their background, and quite honestly, most of the young ladies that we meet who come in, they've been in bad areas and bad things have happened. So we might add EMDR therapy to it. There could be neurofeedback. There could be a lot of different things that are designed to get that part of their recovery done.
Okay.
Then there's other phases. The holistic piece could include acupuncture. It could include meditation. It could include yoga, equine animal therapy, art therapy, and then you'll have nutrition and fitness. So a lot of people, they need to get their endorphins going again.
Right.
And so we get them moving, get them eating better, get them kind of doing things that are going to be healthy. But most importantly is social. And people don't realize that when you take the drugs and alcohol, a lot of their social activities were non-existent for the ones who were really bad. The other ones don't know how to socialize without a drink or a drug going on. So we reintegrate socially by, we have in California, I have a softball team. They go and do a lot of things. So the hard work in between, there's traditional groups, there's traditional therapies, but there's also a lot of things designed for people to learn how to enjoy their life in recovery. And there's a stigma about it that needs to change because people are dying, and they're dying trying to hide something that they think is a dirty secret, and it must be talked about. Being in recovery is cool. I've got a group in California of young people that there's maybe 100 of them now, and they have the best time. They actually have found a way to have fun without getting loaded, and it works, and it's really a joy to see that happen.
Being in recovery is cool. That is a big takeaway. You know, it really is. It's about a life change. It's about getting out and learning how to manage your life in this new way. And there are people here in San Antonio that can help you do that. And that is what they're here for. So we're going to take a break. We're going to come back. We're going to talk about what are the addictions that are most prevalent in San Antonio. And we're going to give you some more information about SOBA and how you can get in touch with them. We'll be right back. This morning we're talking about addictions because there's a place here in San Antonio that it is their life mission to help you. It's called SOBA Texas, and Greg Hannley is here. He's the CEO. Alex Dragici is here. He's the Director of Operations. Now, a lot of you might be sitting at home thinking to yourself, can San Antonio actually support a place like this? Do we really have enough people who are dealing with addictions in San Antonio? I know both of you have an answer to that.
Yeah, the thing is, anywhere that I am in San Antonio, whether I am stopping at a coffee shop, going to pay my cell phone bill, going shopping, going to doing anything, in a drive-through, the second any time comes up what I do, somebody asks for a card, and it seems that an immediate family member in San Antonio needs help. Or a close friend.
It is prevalent. I don't even know what the number is. I feel like it's 1 in 4 is dealing with some kind of addiction.
Yeah, I mean, we were getting phone calls from 2 days ago past midnight.
Really?
I'm getting woken up to my phone ringing that somebody got my phone number or saw the website, or it's nonstop. It's nonstop.
This is the kind of facility where they'll answer the phone at midnight, because I know you care deeply for people who are going through this. What about what is the drug or the addiction that people are dealing with most here in San Antonio?
Most prevalent really anywhere. And I did the intake calls up to a couple of weeks ago and literally dealt with 1,000 people last year. 90% of them had an opiate addiction. Depending on if they were 18 to 20, there was pills. 20 to 22, they were smoking heroin because they couldn't afford the pills or they couldn't get them, and it's cheap and easy to get, and they didn't want to get sick, and then they start shooting about if you're around that environment, you're going to pick up a needle, and all the things they do are something they're just going to do once. So they will, and there's a asterisk next to it that I'll try it once, but I'll never do this. And then and what happens is by the time they're older, a little older, if they're making it through it, they have things that they can't turn back. They have hepatitis C or, you know, blood diseases. So we're trying to get it and turn back the clock on this. And the worst part about it is that it just takes their spirit away, and it takes their hope, and it makes people feel like everybody would be better off without them. And it's just not true. And I'm in recovery myself, and I felt like that.
Yeah.
So when I answer the phone, or the people I have who are on the phone are talking to people, they understand how you feel. And they're not going to judge. They're going to take the time, explain what's going to go on, and have you feel comfortable in the environment to be able to make a good decision.
If someone's at home and they've been listening to us this half hour on San Antonio Living and they're thinking to themselves, I know someone who's dealing with this. I want to call SOBA. I want their help to help my nephew, to help my son, to help my husband. What's the first step for them? What do they do? How do they talk to these people?
Talk to the person with the problem?
Addict, yeah.
Well, the main thing is don't go at it angry. These aren't bad people, they're sick. And people don't want to do this, but they're afraid, they're ashamed. People, and the idea of a traditional intervention where you go in and it works sometimes, but it's kind of a loving approach, and ask them how they're doing, and say, listen, maybe we could talk to somebody. I'm worried about you. And don't put your head in the sand. It's okay to start a conversation.
Yeah.
You might not get somebody to go to treatment that moment, but the conversation needs to be opened. And if, worst case scenarios, if we can get somebody on the phone to us, things that couldn't happen in a year can happen in 5 seconds when you're talking to somebody that gets it.
And that's why Alex is on the phone at midnight with potential people ready to come into SOBA. You know, you mentioned get the conversation going. I hope that this has helped you get the conversation going. Take the show it to someone that you love. Use this show to get the conversation started. The facility is called SOBA. They are here in San Antonio. We're going to be talking about this subject more, of course, in the coming weeks on San Antonio Living, and we encourage you to reach out, get some information if you are suffering from addiction or you know someone who is. The phone number is on your screen. It's 866-547-6451. SOBATexas.com is the website. There is all sorts of great information on the website to get you started in the right direction. And they're on Facebook, they're on Twitter as well. Take the first step, reach out, call them, and they can tell you more about what they're doing here in San Antonio. We'll be right back.